number of new developments in what's being called the biggest cybersecurity attack on America's healthcare system. The Department of Health and Human Services is now investigating after hackers shut down the company's payment processing arm. 3 weeks later, the pharmacy network is now back online, but many providers are still struggling.
As a healthcare organization, we are charged with safeguarding patient data, treating and caring for people in our communities, caring for sensitive information that is protected by law. This is certainly something that we can understand would be of interest to bad actors.
At Common Spirit, we're entrusted with one of the most important things you could ever be entrusted with, and that's human lives. And with that comes a lot of responsibility.
A tabletop exercise is a cyber incident. We're simulating and bringing our key stakeholders into the room across our regions, and we're bringing them together to prepare them. What happens in a comfortable environment to prepare us for the real thing?
It's like anything else that you plan for. So trying to run a marathon without ever practicing beforehand and ever run before, it's going to be really difficult to run that marathon. The preparedness will make the event less scary, less stressful, because you've exercised and you know what to do.
If we are not well coordinated and we are not communicating across the various lines of business, clinical, informatics, and IT, that means that our response is going to take longer. When our response takes longer, it impacts patient care because depending on which systems are down, we may have to go on divert. So the faster we are able to respond and resolve these things ultimately leads to better patient care.
Knowing that we work together as a team of colleagues who are all committed to the same goal of protecting our organization and our ability to care for our communities and each other as best we can. We will talk about what we need to do better, what we already do well, and how we will plan for any incident that may come our way.
It's business as usual. We're going to take care of you. We've got the resources, we've got the tools. Yes, we're dealing with X, but we're here to help and we know how to continue patient care.
I will use this information when I speak to leaders in the hospital. One of my good friends is the CMO at a hospital that I have worked at for a long time. I'll bring this up and say, you know, we had this cybersecurity tabletop exercise. Tell me about what you would do in your facility if you got a phone call tomorrow morning or a text tomorrow morning that says there's been a major incident.
The size and scope of our company as Common Spirit Health it's often lost on me. I think it's often lost on many people. And there's two parts to that. You have more help than you think, and you also have more risk than you know.
Cyber safety is patient safety, and resilience is a part of cyber safety. I would say each one of us can be better prepared by thinking about things outside of the box. What would I do if I didn't have email? Do I know how to paper chart if the EHR system wasn't available? Also, take the initiative to ask your manager whether or not you have a business continuity plan for your team. What would you do if there was an outage and something happened? Has anybody figured that out yet? If you haven't, we have business continuity consultants that can help you figure that out. everyone has a role in making sure that they are ready if something does happen, so that we can protect the most important thing that we're trusted with, and that's the patient in our facility.